Bowel cancer, symptoms, prevention, and treatment. Did you know that bowel cancer is one of the most common types of cancer worldwide? Unfortunately, this disease is affecting an increasing number of people, and many only discover the problem when it is already at an advanced stage, making treatment difficult. That's why it's essential to be aware of the signs and symptoms of this condition and to know how to identify them. In this video, we'll cover everything you need to know about bowel cancer, including risk factors, symptoms, and treatment options. In addition, we'll talk about ways to prevent it, because your health is your most valuable asset. But before we go any further, don't forget to like the video and subscribe to the channel. Around 90% of the people who follow us every week are not yet subscribed, which could lead to them missing out on valuable information about health and well-being. If you're already part of our community, thank you very much for following us. The importance of talking about bowel cancer. This disease affects thousands of people globally and is responsible for around 700,000 deaths a year. In Brazil, according to the National Cancer Institute (INCA), bowel cancer is the second most common cancer among women and the third most common among men, with around 41,000 new cases estimated every year. These figures reinforce the importance of raising awareness about prevention and early diagnosis, which can save lives. Main risk factors. Some factors can increase the risk of developing bowel cancer, such as age. People over 50 are more likely to develop the disease. Family history. Close relatives with bowel cancer increase the risk. Inflammatory bowel diseases. Conditions such as ulcerative colitis and Crohn's disease can be risk factors. Lifestyle. Eating a diet rich in saturated fats, red meat, and processed foods can increase the chances of the disease. On the other hand, a balanced diet with fruits, vegetables, and fiber helps prevent the disease. Sedentary lifestyles, smoking, and excessive alcohol consumption are also factors that can contribute to the development of bowel cancer. It's important to remember that although these factors increase the risk, not everyone with these characteristics will develop the disease. That's why prevention and regular checkups are essential. Signs and symptoms. Symptoms can vary from person to person, but some warning signs include intestinal changes, changes in bowel habits, such as diarrhea or constipation, with no apparent explanation. Blood in the stool, the presence of visible blood in the toilet bowl, on toilet paper, or mixed in with the stool. Abdominal pain. This can be persistent or intermittent, worsening after meals. Unexplained weight loss, lack of appetite, or difficulty absorbing nutrients can lead to weight loss for no apparent reason. Fatigue and weakness. Constant tiredness can indicate the presence of the disease, especially in more advanced stages. Anemia. Low numbers of red blood cells can be associated with internal bleeding. Abdominal swelling. A feeling of persistent discomfort in the abdominal region. Nausea and vomiting may appear in the more advanced stages of the disease. If any of these symptoms persist for more than 2 weeks, it is essential to seek medical attention, diagnosis, and prevention. Bowel cancer can be silent in its early stages, making preventive examinations even more important. A colonoscopy is one of the most effective methods for detecting the disease early, increasing the chances of successful treatment. In addition, some attitudes can reduce the risk of the disease, such as maintaining a diet rich in fiber and low in saturated fats and red meat, avoiding excessive alcohol consumption and not smoking, engaging in regular physical activity, undergoing preventive examinations as advised by your doctor. Treatment. If bowel cancer is diagnosed, there are several treatment options, which vary according to the stage of the disease and the patient's condition. These include surgery, removal of the tumor, and, in some cases, part of the intestine, chemotherapy, use of drugs to destroy cancer cells, radiotherapy, application of radiation to reduce or eliminate the tumor, targeted therapies, specific treatments that act directly on the cancer cells. The ideal treatment should be recommended by a specialist doctor, and medical monitoring is essential throughout the process. Conclusion. Bowel cancer can be successfully prevented and treated when it is identified early. Maintaining healthy habits and having regular checkups are the best ways to protect yourself. Did you like this information? Then like and share this content with friends and family. If you're not already subscribed to the channel, subscribe now to continue receiving important tips on health and well-being.